everyone, my name is Kollaros. Today I will share insights from my research on the role of school nurses in Greek secondary education. My goal is to highlight why school health is not a luxury but a core element of quality and equitable education. I will draw on both international practices and Greek experiences to make the case for a national plan. Health doesn't start in hospitals. It starts in the daily environments where young people spend most of their time. Schools play a decisive role in shaping lifelong habits. When health is addressed early, students show better academic performance, stronger resilience, and more motivation to participate in learning. Most student health problems do not appear suddenly. They emerge step by step through poor sleep, irregular meals, or unmanaged stress. Schools are in the perfect position to recognize these early signs, but only if they have the trained staff. That is where the school nurse becomes essential, helping prevention become a daily strategic part of school life. Nurses' role goes far beyond the stereotypical image of handling minor injuries. School nurses work on prevention, manage chronic conditions like asthma or diabetes, recognize early signs of emotional distress, and educate students on hygiene, nutrition, and mental health. They act as a vital link between families, teachers, and health services. Looking abroad, we see inspiring examples. In Finland, every school has a nurse as part of its staff. In the UK, nurses are public health advocates addressing hygiene, puberty, and mental health. Canada even uses mobile units for rural communities. And in the US, schools with nurses report fewer absences and better chronic care. The key across all countries is the same: stability, clear roles, and integration. In Greece, the reality is very different. Health education is fragmented, usually limited to biology classes or one-off projects. Nurses are rarely present, and when they are, it's mostly in special education or temporary posts. Policy gaps between ministries, combined with rural-urban inequalities, create a patchwork where most students lack consistent health support. Without nurses, much of the responsibility falls on teachers, but teachers are trained for pedagogy, not healthcare. They may notice when a student struggles, but they often lack the training or time to respond effectively. Principals may ask for support, but lack institutional channels to get it. This leads to stress and gaps in students' care. Prevention should never be seen as an extra. It's a strategic investment. Studies confirm that prevention improves attendance, academic success, and emotional resilience. Nurses help schools shift from reacting to crisis to proactively building well-being into everyday learning. Even without a national framework, isolated examples in Greece provide the value of school nurses. In Thessaloniki, a nurse supported diabetic care and mental health. On an island, hygiene education improved habits. In Athens, during COVID, the nurse became emotional support for families. And in Crete, staff learned to respond to seizures with confidence. These success stories show what is possible. When we listen to students themselves, a clear message appears. They want someone they can trust, beyond teachers and parents. They need guidance on puberty, body image, stress, or just someone to talk to. Students with chronic illnesses emphasize how much easier school life is when a nurse is present. Above all, students say being available every day makes the real difference. The strongest model is teamwork. Teachers observe behaviors in the classroom. Nurses provide expertise. Together, they form a feedback loop, identifying problems early, supporting each other, and even running joint wellness programs. This kind of collaboration lightens the load on teachers and ensures holistic support for students. Health is not just about school, it's also about the home environment. Nurses help families navigate medical advice, reduce stigma around mental health, and bridge cultural gaps. Especially in smaller communities, the nurses offer the most approachable figure, building trust not only with students but also with parents. Despite the clear need, Greece lacks a national framework. There is no law mandating school nurses, no defined roles and no staffing standards. Responsibility is split between ministries and very little data is collected to guide policy. Without structure, progress remains fragmented and vulnerable. Funding is another major obstacle. Most nurse positions are tied to short-term EU or municipal programs. This means discontinuity, turnover, and lack of long-term planning. Without stable financing, even successful programs cannot survive or expand. Social perceptions also play a role. Many people reduce the nurse's role to first aid. Others worry about liability or errors. Families sometimes hesitate to engage because they are not clear about what the nurse does. These misconceptions weaken advocacy and delay reform. International experience gives us lessons to follow. Nurses must be permanent, not optional. Clear role descriptions ensure accountability. Data collection helps adapt policies, and perhaps, most importantly, ministries of health and education must collaborate. This integrated approach is what makes the difference abroad. What could a national plan look like? First, define the nurse's role with clarity. Second, establish staffing ratios, such as 1 nurse per 300 students. Third, secure permanent public funding. Fourth, create specialized training pathways. And finally, collect data nationwide to measure needs and progress. The path forward is achievable. Greece must move from temporary to permanent structures, strengthen collaboration across ministries, raise awareness of the nurse's role, and implement pilot programs with clear evaluation. This combination can create the foundation for a sustainable school health system. In conclusion, school nurses are proven to improve attendance, well-being, and academic outcomes. They reduce the burden on teachers, connect families with school, and create safe, inclusive environments. Health should be recognized as a core condition for educational equity, not as a secondary concern. I will leave you with this thought. No child should be forced to choose between learning and well-being, and no school should be expected to function without care at its heart. Thank you for listening, and I look forward to your questions.